Heart failure is a complex clinical syndrome that arises when the heart is unable to pump sufficient blood to meet the metabolic needs of the body. It affects millions of people worldwide and is a leading cause of hospitalization in older adults. Understanding the pathophysiology, assessment techniques, and nursing management strategies is essential for nurses to provide safe, effective, and evidence-based care. Heart failure can be broadly categorized into two types: left-sided and right-sided heart failure. Left-sided heart failure is further divided into systolic and diastolic dysfunction. Systolic heart failure, also known as heart failure with reduced ejection fraction, FREF, occurs when the heart's left ventricle cannot contract effectively, leading to decreased ejection of blood. Diastolic heart failure, or heart failure with preserved ejection fraction, occurs when the left ventricle becomes stiff and does not relax properly, impairing its ability to fill with blood. Right-sided heart failure usually results from left-sided failure but can also be caused by pulmonary diseases, such as chronic obstructive pulmonary disease, COPD, leading to a condition known as cor pulmonale. In systolic heart failure, decreased cardiac output triggers compensatory mechanisms including sympathetic nervous system activation, renin-angiotensin-aldosterone system, RAS, stimulation, and release of antidiuretic hormone, ADH. These responses aim to maintain perfusion but ultimately contribute to worsening heart failure by increasing preload, afterload, and myocardial oxygen demand. In diastolic heart failure, impaired ventricular relaxation results in increased left atrial pressure and pulmonary congestion, even though the ejection fraction may remain within normal limits. Signs and symptoms of left-sided heart failure include dyspnea, orthopnea, paroxysmal nocturnal dyspnea, fatigue, and signs of pulmonary congestion such as crackles, wheezing, and a cough that may produce frothy sputum. Right-sided heart failure presents with systemic congestion signs such as peripheral edema, ascites, hepatomegaly, and jugular vein distension. Both types may present with decreased exercise tolerance and reduced perfusion to vital organs. Assessment of a patient with heart failure involves a thorough history and physical examination, vital signs, fluid status evaluation, and diagnostic tests. Nurses should assess for weight changes, peripheral edema, breath sounds, oxygen saturation, and signs of hypoperfusion. Daily weight monitoring is crucial as sudden increases may indicate fluid retention. Assessment tools such as the New York Heart Association, NYHA, functional classification can help determine the severity of heart failure symptoms and guide treatment plans. Diagnostic investigations include chest X-ray, which may show cardiomegaly or pulmonary edema, and an echocardiogram, which evaluates ejection fraction, wall motion abnormalities, and valve function. Blood tests such as B-type natriuretic peptide, BNP, or N-terminal proton help support the diagnosis and severity of heart failure. Electrocardiogram, ECG, can detect arrhythmias, ischemia, or left ventricular hypertrophy. Nursing management of heart failure involves both acute care and chronic disease management. In the acute setting, priorities include stabilizing the patient, relieving symptoms, and preventing complications. Oxygen therapy may be needed for hypoxia. Medications are critical in managing heart failure and may include diuretics such as furosemide to reduce preload, ACE inhibitors or angiotensin receptor blockers, ARBs, to reduce afterload, beta blockers to decrease myocardial oxygen demand, and aldosterone antagonists to prevent remodeling. Nurses must monitor for medication side effects such as hypotension, electrolyte imbalances, and renal dysfunction. Fluid restriction and sodium limitation are essential components of management. Nurses must educate patients and caregivers on the importance of limiting sodium intake, typically to less than 2 grams per day, and monitoring fluid intake, usually restricted to 1.5 to 2 liters per day. Accurate intake and output monitoring is vital to evaluate fluid balance and guide treatment decisions. Chronic heart failure management involves lifestyle modifications, medication adherence, and regular follow-up. Nurses play a key role in patient education, ensuring that patients understand the importance of daily weight monitoring, recognizing early signs of decompensation such as increasing shortness of breath, swelling, or weight gain of more than 2 kilograms over 2 days, and when to seek medical help. Physical activity should be encouraged within the patient's capacity, and cardiac rehabilitation programs can provide structured support. Psychosocial support is also crucial as heart failure can significantly affect quality of life, leading to depression, anxiety, and social isolation. Nurses should assess for emotional well-being and refer patients to mental health professionals when needed. Another essential aspect of nursing care is medication management. Polypharmacy is common in heart failure, and nurses must be vigilant in ensuring that medications are taken correctly, especially in older adults who may have cognitive impairment. They must also recognize potential drug interactions and collaborate with pharmacists and the medical team to optimize therapy. Advanced heart failure may require interventions such as implantable cardioverter defibrillators, ICDs, cardiac resynchronization therapy, CRT, or ventricular assist devices, VADs. Nurses caring for these patients must be knowledgeable about device function, potential complications, and postoperative care. Palliative care is an often overlooked but essential component of heart failure management, especially in end-stage disease. Nurses must assess symptom burden, provide comfort care, and facilitate discussions about goals of care and advanced care planning. Involving palliative care teams early can improve quality of life and reduce hospital admissions. Heart failure care must also be culturally sensitive and person-centered. Nurses should engage patients in shared decision-making, respect cultural beliefs about illness and treatment, and provide tailored education. For instance, dietary advice should consider cultural food preferences and accessibility. Health literacy must also be assessed, ensuring patients understand complex medical information in a way that is meaningful to them. Technology is increasingly being used in heart failure management. Telemonitoring allows for remote assessment of weight, symptoms, and vital signs, enabling early intervention and reducing hospital readmissions. Nurses should be comfortable using and teaching patients how to use these technologies effectively. Transitions of care are critical moments for heart failure patients. When discharging a patient from the hospital, nurses should ensure that the discharge plan includes clear instructions, medication reconciliation, follow-up appointments, and access to community supports. Poor transitions can result in early readmission and poor outcomes. In the Australian aged care context, heart failure management requires additional considerations. Older adults may present atypically, such as with confusion or functional decline rather than classic symptoms. Comorbidities such as renal impairment, cognitive decline, or frailty complicate management. Nurses working in residential aged care facilities must coordinate with general practitioners, nurse practitioners, pharmacists, and allied health professionals to deliver multidisciplinary care. Monitoring for signs of decompensation, maintaining up-to-date advanced care directives, and involving family and care planning are essential practices in aged care settings. Preventive care also plays a vital role. Nurses should promote healthy lifestyle choices, such as smoking cessation, weight management, and management of hypertension, diabetes, and dyslipidemia, all of which are risk factors for heart failure. Immunizations such as influenza and pneumococcal vaccines should be offered to reduce the risk of respiratory infections that can worsen heart failure. Research continues to evolve in heart failure care. Emerging therapies such as sodium glucose cotransporter 2, SGLT2, inhibitors have shown promise in reducing hospitalization and mortality in both FREF and FF. Nurses should stay updated with evidence-based guidelines, such as those from the Heart Foundation, to ensure their practice aligns with the latest recommendations. In summary, heart failure is a chronic, progressive condition that requires comprehensive nursing care across acute and community settings. Understanding its pathophysiology helps nurses to interpret clinical signs and anticipate complications. Skilled assessment, vigilant monitoring, patient education, and interdisciplinary collaboration are cornerstones of effective heart failure management. As frontline providers, nurses have a unique opportunity to make a meaningful difference in the lives of patients living with heart failure through education, empathy, and evidence-based care.